Hello, Dr. Henry. Thanks for taking my question. I'd like to ask about the accessibility to COVID testing. In Ontario, they've started making that service available to people at pharmacies if those people are thought to be asymptomatic, and apparently they're pre-screened over the phone for that. Do you see that sort of service being available in BC to help with the backlog or overload of testing?
Yeah, we've been looking at this. As you know, Ontario and Alberta and a few other provinces had done a lot of asymptomatic testing in people who didn't have exposures, and in those situations, the yield, as we call it, was very, very low. So it did not increase our ability to find cases or clusters or outbreaks or manage and control in our community. Here in BC, we've always been focused on making sure those people who actually need a test have it and have it available, and it has been challenging. I know there's been challenges with some of the phone lines and with some of the clinics, and we've also had challenges with accessing reagents. So one of the things that we are thankful for that Ontario has moved to this, Alberta has also moved to reduce the amount of low-risk asymptomatic testing they're doing, because it used up a lot of the reagents that we all needed across the country to do this testing and focus on the people who have a risk. So we will continue to focus on people with risks of exposure, risks of infection in BC. We have been looking at what are some other ways that we can reduce the lines in our clinics and increase our capacity in the back end in the lab to do the testing. One of the things that we're doing, of course, is using the swirl and spit test, which will help because people can do it without a healthcare worker. We're also looking at some of the tests that can be the more rapid point of care tests that might be helpful for identifying quickly if we have an outbreak in an area. It is all under flux. We had actually another hour-long conversation about it earlier today. So we are looking at, as we've said many times, trying to increase our capacity to test to up to about 20,000 tests per day, and is a challenge that has many different facets to it. So having people go to a pharmacy is not off the table, but it's not what we're focusing on right now.